Hello and welcome to Pre-Hospital Hub. Today we're going to explore the effects that digoxin has on ECGs and briefly touch on what digoxin is and what medical conditions it's used for. And this may be helpful when we attend patients that are currently taking digoxin, and if we take an ECG and we see some findings that are not normal, and this could be put down to digoxin use, or if patients are taking digoxin but unsure why, this may be helpful in determining maybe what condition, other medical conditions they have. So what is digoxin? So digoxin has been in use for more than 200 years, which was originally used as a herbal remedy. Digoxin is derived from the foxglove plant and is highly toxic if given in large and quickly repeated doses. Digoxin belongs to the class of drugs called cardiac glucosides, which operates by inhibiting the sodium-potassium ATPase pump. So what this does, it stops the osmotic equilibrium and membrane potential in cells, so that the normal higher concentration of sodium outside the cells and a higher level of potassium inside the cells is changed to allow increased levels of sodium inside cells, which provides a number of benefits to the heart. Digoxin is often used in a number of heart conditions, and this action of the ATPase pump inhibitor elevates sodium levels inside the cells. This provides several benefits to the heart. One of the benefits that digoxin has on the heart is increased contractility or output force on the heart. The elevated sodium from the drug helps the heart muscles contract more forcefully, improving the heart's pumping action. Another benefit that digoxin or cardiac glucosides have is that it can decrease heart rate. This happens as this class of drug has a vagomimetic effect. So basically it resembles the stimulation of the vagus nerve on the AV node. By this stimulation of the parasympathetic nervous system, electrical conduction to the AV node decreases, leading to a decrease in heart rate. These benefits are useful in heart conditions such as heart failure or certain irregular heart rhythms like AF. Touched on, digoxin can help in conditions such as AF, as it can help slow heart rate and aim to reduce strain over time on the heart. Digoxin can also be used in other conditions such as heart failure, again reducing load on the heart by decreasing heart rate, but also with the increased contractility. Digoxin, however, is often seen as one of the last drugs to be considered over more effective and less dangerous drugs. Occasionally, digoxin is prescribed to patients with permanent AF who are very inactive. In heart failure, other medications are used first, such as beta blockers, ACE inhibitors, and ARBs before consideration of digoxin. So what ECG changes can digoxin have? So digoxin use can show some classic ECG changes. It is important to remember that the following ECG changes do not reflect digoxin toxicity, but rather the therapeutic dose that patients would take daily. The most characteristic ECG change when taking digoxin is the scooped appearance in the ST segment. This distinctive downward slope and scooped appearance of the ST segment, mimicking ST depression, is sometimes referred to as a reverse tick. As you can see, we've got a ST depression here, and then we've got the almost reverse tick. Another helpful way to remember this ST segment appearance is to think about Salvador Dali's moustache. He was known as a famous Spanish painter, known for his striking and bizarre images, and in this case of ECGs, thanks to his moustache and the appearance of scooped ST depression, is similar. Another change that digoxin can have on ECGs may be abnormal T waves. However, it's important to note that abnormal T waves can be seen in a lot of other conditions as well. A biphasic T wave with an initial negative deflection and a terminal positive deflection is the most prevalent type of T wave abnormality. The depressed ST segment usually coincides with the first portion of the ST wave. The terminal positive deflection could have a prominent U wave superimposed on it, or it could be peaked. So here we could have a U wave disguised within the T wave, causing it to become more peaked. Other T-wave abnormalities that could be present is inverted T waves or flattened T waves. Peak waves tend not to be as common in digoxin use. So we may also see a short QT interval, less than 350 milliseconds, or there may be an increased PR interval of greater than 200 due to digoxin being a cardiac glucoside. This slows down the conduction of electrical impulses through the AV node due to the increased vagal effects mentioned previously. So a quick summary of the ECG changes before we move on to ECG examples. So in summary, digoxin therapeutic doses are usually associated with a distinctive downward scope ST segment, a short QT interval, abnormal T waves either flattened, inverted or biphasic, most commonly biphasic and normally disguised within the ST segment. And we can also have an increased PR interval. So our first ECG example. So if we firstly look at the rate and rhythm, we can see it is irregularly irregular, and we can't note any P waves or lack of distinguishable P waves. So this would suggest that we have AF. So if we have AF, we could automatically consider we on the medication for AF. We could be on digoxin or some other medications that are more commonly used now. There is distinctive downward scooped ST segments, most evident in leads 1. And we also got them in AVL slightly, and then V4 to V6. We've also got classic scooped ST segments, which look similar to the digoxin effect. So from this, we can probably suggest that this ECG shows AF and the digoxin effect. If we look at this ECG example now, rate and rhythm is regular. We have got P waves, but they are very small. We've got ST depression in the anterior septal region, so from V1 all the way to V4. Got a slight in V5 as well. There is also dominant R waves in V2 and V3. Q waves can also be seen in AVL and lead 1. So currently it's not really consistent with the digoxin effect because our ST depression doesn't look scooped. We've also got some Q waves present. We've also got peaked and tall T waves throughout, seen in leads 1. We can see them in leads V3 to V6. Peak T waves are not commonly associated with the digoxin effect. So this findings from ECG suggests a posterior STEMI due to the ST depression in the anterior septal region. To confirm this, we could move leads V4 to V6 around to the back to show V7 to V9, which would show ST elevation, and we only need 0.5 millimeters of ST elevation on V7 to V9 to confirm a posterior STEMI. In summary, digoxin can be used and prescribed for various heart conditions such as AF or heart failure, but now it's often seen as the last line of treatment due to more effective drugs. Therapeutic digoxin dosages can cause characteristic ECG changes such as ST segment changes, so the scooped ST segment, the T-wave abnormalities, with the most common being biphasic with a negative deflection first, then a positive, short QT intervals, and prolonged PR intervals. So I hope you enjoyed this video on digoxin and how it can affect ECGs and what digoxin is used for. If you want more information on digoxin and the effects that it has on ECGs, you can always go to the website prehospitalhub.co.uk. You can also test your knowledge on Prehospital Hub by taking our digoxin ECG quiz. And if you have any questions around this or any other prehospital topic, you can always use our QA forum, which can be found on our website.